Hi, I'm Sarah Passmore, and I'm a nurse practitioner student at Auburn University. And I'm here to talk to you about influenza, also known as the flu. Influenza is a contagious respiratory illness caused by the influenza virus. It can infect the nose, the throat, and sometimes even the lungs. Cases can be mild to severe. Severe cases can lead to hospitalization or even death. So, this infection is very important to catch early and to treat because it is so contagious. Through the months of the fall and the winter is when the flu is rampant. So, it's very important when you have patients come into the clinic around these seasons to ask them, have you been vaccinated for the flu? If they haven't, it's great to provide education then on why it's important to be vaccinated, and that is to help prevent the risk of them developing the flu and even spreading the flu because it can turn into an epidemic. So some symptoms to look out for when a patient comes in is, are they fatigued? Do they have a fever? Are they coughing? Do they have a sore throat? Chills, headaches, and even diarrhea and vomiting. When patients come in, make sure you're assessing their lymph nodes. Are any lymph nodes enlarged? You can even do a CBC. White blood cell counts, since this is a viral infection, are going to be normal usually. Assess their throat, look into their ears, see if it's any sinus drainage. Do they have sinus pressure? Could this be a sinus infection? I encourage that everyone who comes in around these specific months, just go ahead and give them a flu test. Even if they come in saying they are just extremely tired, they could still be having the flu and not fully have all the symptoms. And not everybody that has the flu has a fever, so that's important to know as well. So also, it's important to educate patients on how is the flu spread. It's spread by tiny droplets. That's when people are coughing, sneezing, or even touching or talking. When they're touching objects and they've sneezed in their hand and they touch it, it spreads. So it's important, if you know somebody who's infected with the flu, that they are getting treated and not around other individuals because they can get them sick. So if you have a patient come in, it's important to assess their lungs, look in their throat, look in their ears. Go ahead and see, is the cough productive? Is it not productive? Have they been around anybody that's been sick? The flu is very contagious, and people that are at risk are going to be those that work in environments with a large group of people, or even healthcare workers, people at daycares. High-risk patients are going to be children, people who are pregnant, elderly, people who have a low immune system, and people with chronic diseases. When people are infected with the flu, they're most contagious day 3 and 4 after being infected with the flu. They can infect people one day before they even experience symptoms. So that's how contagious this infection is. And then also they can spread the flu 5 to 7 days after becoming infected. So if you find a patient, get the rapid flu test to them. If they come in complaining of any type of symptoms of being around people who are sick, cough, sneezing, headaches, fatigue. Most people are extremely fatigued. Educate people that come into the clinic before flu season about going ahead and getting their flu vaccine. If you do have a patient that does have positive symptoms and even a positive flu test, then the best way to treat them is with an antiviral, Tamiflu, and even using ibuprofen and NSAIDs to help with any type of headaches or body aches that they're having. It's very important with patients that you explain the risks of the flu and how easily spread it is. So having the flu vaccine can help prevent epidemic of spreading this infection. Also, many people who have been around people with the flu, they might have heard that if you get the vaccine, that it can cause you to get the flu, and that is not true. That is a myth. So get vaccinated, help educate other people to get vaccinated, and then if you do encounter any patients with the flu, go ahead and give them some Tamiflu. Rest, hydrate. Tell them not to be around anybody for at least 48 hours while they are on their antibiotics, and go ahead and tell them to not, if they're coughing, sneezing, make sure that they're covering up their nose, and then also wash hands, and tell children and even other adults, don't be sticking your hands in your face. So I hope this helps.